There it is.
All right. Looks like we have go live. Well, welcome everyone. Today we'll kick off today's May 26th, 10 a.m., a little bit after 10 a.m. And today the Legislative Audit Commission will call to order. And before us today, we're going to cover the Legislative Audit Report on the behavioral services and grants management within the Department of Human Services. And welcome, I see commissioners on board, and good morning, everyone. And I think to kick it off, I believe the Deputy Legislative Auditor, Laura Lysing, is going to kick us off, and then we'll get rolling into the report. Ms. Lysing.
Good morning, Mr. Chair and members. Can you hear me okay?
We're good.
Okay. I'm Lori Lyson. I'm the Deputy Legislative Auditor for the Financial Audit Division. And this morning we are going to present one of our internal control and compliance audits. And that audit was performed of the Behavioral Health Division at the Department of Human Services. Specifically, that audit looked at internal control and compliance with grants management. And that audit was overseen by Valerie Bombach, who is the audit director over the Health and Human Services line of business. I'm going to turn it over to Valerie now, and she'll present that audit and the findings that were identified. Thank you.
Thank you, Ms. Lysing. Ms. Bombach, if you could again restate your name and your position for the record.
Thank you, Mr. Chair, members, and thank you, Ms. Lyson. Again, good morning. I am Valerie Bombach, and I'm the director in the Office of Administrative. I'm going to start our slideshow here.
Ms. Bombach, your initial audio is a little bit sketchy, so if you could either speak more loudly or directly into your microphone.
Is that a bit better?
It is.
Okay. So again, as Ms. Lyson mentioned, I'm presenting the results of our internal controls and compliance audit of the Department of Human Services Behavioral Health Grants Management. So Jordan Bionfald from our office coordinated and conducted this audit along with our auditors, Melissa Struntz, Dwee Nguyen, and William Hager. We conducted this audit for several reasons. We had heard concerns about management of the Behavioral Health Division previously. Through a recent OLA review of overpayments by the division for take-home self-administered opioid treatment, we had identified gaps in management oversight. DHS created the Behavioral Health Division when the department merged the Adult Mental Health, the Children's Mental Health, and the Alcohol and Drug Abuse Division. And now today it is a large division with about 140 staff. This DHS process to merge these divisions into the single Behavioral Health Division took place for over several years, and it concluded in early 2018. During and subsequent to this merger, there were numerous changes in the division's organizational structure, staffing, internal policies and procedures, and management overseeing the division. And in this environment, there's an increased risk of internal control issues as well as non-compliance. The Behavioral Health Division also oversees a high volume of grants, provider payments, and related funding. And I'll expand on this in the next slide. And then lastly, OLA had not specifically audited the division before. I'll cover some background about this topic. The Department of Human Services oversees Minnesota's mental health and substance abuse prevention and treatment services that are paid for with state and federal funds. Behavioral health services include prevention, treatment, short-term and long-term care, and home and community-based services. The Behavioral Health Division administers behavioral health services by making direct payments to providers through the DHS Behavioral Health Fund. The division also issues grants to local human services agencies through a formula allocation that is defined in law, and then also issues grants to counties, tribes, and providers through a sole source or a competitive bid process for contract grant agreements. As I mentioned, the division handles a lot of grants. Its caseload totals about 700 grants annually and manages about $134 million total. This includes all types of grants, and this is on a rolling basis. There are grants that open in a given year and then close during that year as well. And then there are two types of grants. As I said, we've got the formula grants that are funded through allocated by DHS to county and tribal human services agencies based on formulas prescribed in law or rule. And we did not audit the formula grants. Rather, we focused on contract grants. So contract grants are funds issued by an agency through grant agreements, and it includes three types of grant awards: the competitive bid, the sole source, and the legislatively named. So the competitive bid involves a process in which multiple grant applications are solicited and reviewed, and grants are generally awarded to applicants who most closely meet the selection criteria. The legislatively named are just that, the amount and purpose of a grant, and sometimes the grantee are stated in law. And then lastly, the sole or the single source contracts is when an agency may, with proper authorization and under certain circumstances, award a grant directly to an organization. Just for the contract grants, the expenditures are considerable. For example, in fiscal year 2019, division expenditures through the contract grants totaled more than $58 million for about 400 contract grants that were open throughout that year. When administering grant agreements, DHS, meaning the Behavioral Health Division, must follow the Department of Administration's Office of Grants Management policies and procedures and other grant-related legal requirements. And we use this criteria in our audit work. For this audit, our objectives were to determine whether DHS and the Behavioral Health Division had adequate internal controls, and by that I mean policies and procedures, and as well as to determine whether they complied with significant legal requirements in three main areas. First, the management of the Behavioral Health Division, the grant award process, and then the oversight of the contract grants and payments. Again, our audit scope focused on contract grants. We did not look at professional technical contracts. That's a different instrument. The direct payments to providers through the Behavioral Health Fund or the formula grant. Our audit period was from July 2017 through March 2020. So this covers part of the period of the merger process for the three DHS divisions. For our work, we pulled and audited multiple rounds of samples of grant agreements, requests for proposals, and then the related financial and monitoring documents. And I mention this because we pulled multiple rounds of samples to ensure we were confident that the issues that we were seeing were pervasive. So what did we find? What did we conclude? We concluded that DHS, through its Behavioral Health Division, did not comply with legal requirements and state policies related to grant oversight. We also concluded that the department's internal controls, again, the policies and procedures, were not adequate to ensure that DHS, through its Behavioral Health Division, safeguarded assets and ensured compliance with the legal requirements and state policies related to grant oversight. I'll note that we identified control weaknesses in all areas of our audit scope, including management of the division, the awarding of contract grants. I'll start with our findings related to management.
Ms. Bombach, you cut out again in the last 20 seconds there. Maybe we'll have to have the Mr. Nobles upgrade your infrastructure. But if you could just go back to the last 20 seconds and speak closely into your microphone.
Mr. Chairman, it would probably help if we all muted and stopped our video. That often helps in other meetings, and when we have something to say, we can come back on. That might help her. That's what I'm going to do.
Thank you. And yeah, Ms. Bombach, we would prefer your video on as well, but if we can, speak closely to the mic. Thank you.
Okay, so again, I'll just reiterate that we identify control weaknesses in all areas of our audit scope, including management of the division, the awarding of contract grants, and oversight of grants and payments. I'll start with our findings related to management of the Behavioral Health Division. And these findings broadly address requirements in state law for state agencies. First, state and federal laws require that state agencies implement and maintain effective internal control policies and procedures to mitigate fraud, waste, and abuse, and ensure programs are administered in compliance with legal requirements and the terms and conditions of the federal award. However, DHS and the Behavioral Health Division lacked effective oversight of the division's grant administration to ensure compliance with OGM policies and the related legal requirements. Again, this was a newly merged division, but the division administrators did not analyze the risk of fraud, waste, abuse, and noncompliance. This is a requirement in state law. The division also did not evaluate internal controls, the policies and procedures for effectiveness. Behavioral Health Division had inadequate processes to assign grant managers and to accurately track key events of all division grants. And by that I mean track a particular grant from the request for proposals and initial award through the closeout process. Division also lacked basic case management tools, such as written standardized procedures and checklists that would help ensure staff effectively completed grant management tasks defined in state policy. And this really was a common theme throughout our work. The lack of these basic case management tools limits the ability of staff and supervisors to verify whether required procedures were followed, whether correct documents were created, and whether proper authorization was obtained. And so we concluded that the pervasive lack of internal controls and leadership in the Behavioral Health Division led to the division's noncompliance with state personnel policies, OGM policies and procedures, and legal requirements related to record keeping and grant management. So our next finding relates to record keeping. Government entities must follow legal requirements related to the creation and maintenance of public records. And specifically, all officers and agencies of the state must make and preserve all records necessary to show a full and accurate knowledge of their official activities. They also must keep records containing government data in such an arrangement and condition as to make them easily accessible for convenient use. However, throughout our audit, we found a pervasive lack of documentation related to the Behavioral Health Division's administration of grants. BHD representatives were often unable to provide us with most of the requested evidence and key documents that would demonstrate to us the division's compliance with OGM policies and procedures. So when I say for requests for documentation, this would include, for example, completed conflict of interest disclosure forms, grant application scoring sheets, progress reports, financial reconciliations, evidence of monitoring visits, and grant closeout evaluations. However, regarding the record keeping practices, we found that division administrators did not have written policies and procedures in place to detail how the division complied with the state's official record statute and even with the department's retention schedules. BHD administrators also did not formally identify the grant-related documents that grant managers should create and preserve, and how or where grant managers should retain such documents. So without adequate internal controls to address these deficiencies, the division may not create and properly preserve historical information related to grant awards, the vendor's performance, grant outcomes, and the oversight of state and federal funds. We concluded that DHS's lack of policies and procedures for document creation, retention, and storage of BHD grant management documents contributed to the division's noncompliance with, again, state requirements for grant oversight. We also found that the Behavioral Health Division administrators did not ensure that employees had the appropriate skills, knowledge, and job descriptions to manage grants in compliance with state and federal requirements and the terms of the grant agreement. So to help ensure employees have a clear understanding of their job responsibilities, state, and by that I mean M&B, Minnesota Management and Budget, policies and procedures for state agencies require that state employees have current position descriptions that clearly lay out their job duties and tasks, and that each employee has an accurate, up-to-date position description that is reviewed at least annually and rewritten at least every 3 years. However, we found that division supervisors assign some grants to staff who lack grant management training and experience, or staff whose job duties did not explicitly describe the tasks related to managing behavioral health grants. For example, we pulled a sample of 24 position descriptions for grant managers, and we found that the grant management duties were inadequately defined in 5 of the 24 position descriptions, and in 6 position descriptions, they were not current as required by M&B policy. BHD administrators also did not provide adequate training to staff who manage grants. They did not ensure staff were aware of requirements related to grant management, and also identify and communicate minimum expectations for training to all of its employees. For example, BHD administrators did not coordinate, mandate, or enroll employees in Office of Grants Management training or other training essential for grant managers. And I'll note that state law does not require OGM training for state employees to manage grants. We think that these factors contributed to the division's non-compliance with requirements for the award of grants, again, oversight of grantee activities and payments, and the evaluations of grantees. Our next findings relate to the grant award process. Again, state agencies must follow the OGM policies and procedures for the oversight, the solicitation and publication of grant opportunities, the evaluation of grant applications, and the award of grants. Many of these requirements and policy are intended to promote fairness, precision, and consistency in the award of competitive bid grants. However, we concluded that the Behavioral Health Division did not fully comply with legal requirements and the OGM policies to mitigate conflict of interest in grant oversight and the grant award process. And so from here on this slide, I really want to focus on this first finding here related to conflict of interest disclosure. And this is really an example of the lack of documentation that we encountered as we were conducting this audit. You can see from the slide that for 21 of 25 sample grant agreements and the related requests for proposals, the Behavioral Health Division did not provide us with any conflict of interest disclosures by grant managers. So non-compliance with conflict of interest legal requirements leaves the state open to potential fraud and waste. Grant evaluators may rank grant applications in a biased manner. Grants may be issued to applicants who are not best suited to serve in the state's interests. Also, applicants who are the most qualified may be denied a grant award. Finally, the state is at risk of a grantee not performing in accordance with the grant agreement due to the conflict of interest with the grant manager. Regarding the grant award process, we also found that the division did not always use a required standardized process for scoring the grant applications and when evaluating the applications through a competitive bid process. Grant evaluators did not determine whether grant recipients were financially stable prior to awarding the grant. They are required to examine financial statements to assure that the entity receiving them does have the capacity to perform the services required in the grant agreement. And then the division also did not demonstrate to us through documentation its compliance with grantee selection requirements. And so here in this item, for example, we found deficiencies in 5 of 13 samples. For one sample, BHD grant evaluators did not award the grant to the highest scoring applicant. and which they can do, but they must document the rationale for doing so. However, the documents that we received were insufficient to determine the rationale for not following the division's standardized scoring system. And then for 4 of 5 samples with these deficiencies, the Behavioral Health Division did not provide us with any documentation regarding the scoring criteria, the scoring results, the final ranking, and the rationale for the grant awards. Next, I'll turn to key findings regarding the oversight of grants and payments. State statutes require that a granting agency must diligently administer and monitor any grant that it has entered into. The OGM policies and procedures require that agencies carry out certain activities to oversee grants and ensure the grant activities, the expenditures, and the results align with the objectives and expected outcomes of the grants. We concluded that the Behavioral Health Division did not have adequate internal controls and ensure compliance with the OGM policies and related legal requirements for things such as monitoring grantee progress, conducting monitoring visits and financial reconciliations, and evaluating grantee performance. So, for example, OGM policy and procedures state that the agencies must monitor progress on state grants by requiring grantees to submit written progress reports for review at least annually until all the grant funds have been spent and all of the terms in the grant agreement have been met. Further, an agency should not pay a grantee if there are past due progress reports unless the agency has given the grantee a written extension. And so on this item, for example, for 20 of 25 sample grant agreements that we tested, the Behavioral Health Division either did not obtain progress reports or the progress reports were deficient. And here's where we would say a type of control would be a case management system. And that type of system would be helpful in that it could indicate when progress reports are due and to notify employees to restrict payments. OGM policy also requires that state agencies monitor the performance of some grantees through monitoring visits before the agency makes the final payment under the grant. And so monitoring can occur either through phone conferences or site visits. The department is also required to keep that documentation on file. However, for 41 of 45 samples that we tested, the division did not provide us with any documentation or evidence of site visits. And here we would say that, again, if there were, the division had standard forms and checklists and instruction on how and where to document such site visits, we think that that would impact compliance with the requirements. Agencies also must conduct a financial reconciliation of grantees' expenditures. And this process involves reconciling a grantee's request for payment with supporting documentation for that type of request. So the supporting documentation would be like purchase orders, receipts, payroll records. And again, the results of the financial reconciliation must be kept in the grant file. So for here, for example, for 44 of 45 samples, that's basically all of them, the division did not provide any evidence of a financial reconciliation. Again, we would say this is an area that if the employees had training and instruction about how to do it and where to store that information, it would impact their the compliance by the staff. OGM policy also requires grant evaluators to consider a grant applicant's past performance before awarding subsequent grants to them. As part of this, state agencies must ensure through an evaluation process that certain information, such as grantee compliance with grant provisions and grant outcomes or concerns about fraud, waste, and abuse, is documented and available for review. However, again, looking at our samples, for 38 of 45 samples, the division did not provide us with any evidence of a closeout evaluation of the grantees. Here again, a systematic process to track when evaluations were due, or a process by which a supervisor monitors whether a grant manager completed the evaluation would address this. So without a record of past performance, the Behavioral Health Division could award grants to grantees who did not perform in accordance with a previous grant agreement, or for whom grant managers otherwise have concerns about performance. I'll turn now to our recommendations, and we have many recommendations in the report. They're listed in pages 37 and 38 in the report, and they're too numerous to list in the slideshow. However, I've listed here the key recommendations and then summarize the others here in the bullet. First, I want to note that we as the auditors see that the issues with non-compliance really flowed from what we think is inadequate management and leadership in the division. And so for us, the key recommendations are that management should conduct a risk assessment and should continuously conduct these risk assessments of the division's oversight of grants. Again, agencies are required to do this, and the division had not done a recent assessment since the creation of the division, since the merger of the 3 divisions into one. We also think DHS and the Behavioral Health Division should design, implement, and maintain a system of effective internal controls to administer grants and ensure compliance with state policy and law. Again, when we talk about internal controls, we're talking about standardized processes, written policies, checklists, effective supervisory review, and end-to-end case tracking capability. Management and staff also should make and preserve required documentation related to grant oversight to ensure compliance with record-keeping requirements and the department's own retention schedule. And then management should also ensure that the division staff have necessary skills and knowledge to oversee grants. Should be through training and updated position descriptions. And then this last recommendation summarizes that what we say is that BHD leadership and staff should comply with the OGM policies and procedures and legal requirements for the grantor process and oversight of grants and payments. Again, here we're talking about the conflict of interest disclosures, the grantee selection, financial reviews of grantees before a new award, progress reports and financial reconciliations, monitoring, and closeout evaluations. And then before I conclude my presentation, I do want to mention that as we were conducting our audit, the department had initiated efforts to address a lot of the concerns that we had heard as well regarding oversight of the division. They had a couple of lines of effort underway. I would say that as we were, this was outside of the scope of our audit after we were already up and running on our audit. We were provided with certain documentation that laid out timelines for doing this work. They were planning a lot of changes. They had implemented some improvements to the division. However, some of the improvements, the actual actions to change the division, were not slated to begin until it would be April 1st of this year. So this was after we released the report. So with that, Mr. Chair, I would conclude my presentation and would be happy to answer any questions, or perhaps if you would like to hear from the department first.
Thank you, Ms. Bombach. I think what I would like to do is, I know Representative Erickson has her hand up. I would like to have the commissioner give her remarks first, and Commissioner Harpstead, if you could do that in 10 minutes or so, because I'm sure there's quite a few questions and conversations to be had. But I think what we have to take care of, I missed an initial requirement for kicking off our meeting. We didn't do the appropriate roll call when we kicked off our meeting. So if I'm not sure who on the OLA staff, if we could do the appropriate roll call, and then we'll get into Commissioner Harpstead, and then we'll get into the Q&A. So roll call, please.
Senator Benson.
Here.
Representative Bernardi.
Here.
Representative Erickson.
Present.
Senator Frentz.
Here.
Representative Hansen. He might not be able to unmute himself. No. He's here on the
We may need to
phone, I know, yeah. Senator Kiffmeyer,
Present.
Senator Klein, Senator Coran,
Present.
Representative Liebling,
Present.
Representative Pearson,
Pearson present.
Representative Quam,
Present.
Senator Rest.
And we know Senator Rest was present at the beginning and had to step away and may rejoin. So,
Okay, thank you.
thank
Roll
you.
call.
Thank you for the roll call. Thank you for the roll call. And with that, I'd like to move to Commissioner Harpstead. Commissioner Harpstead, the floor is yours.
Thank you very much. Chair Karan will be putting up a slide presentation here. Going back to December of 2019, my 90-day report added up every error we could find in 2019 and pointed out that they added up to 0.1% of our payments over 6 years, and that the Department of Human Services was not in total chaos. In order to go after that 0.1%, we initiated Operations Stopgap and Swiss Watch, brought in an outside national consultant to review our process control steps in relation to several comparable states, and appointed new process control champions throughout the department. We also further centralized financial and compliance functions across DHS. We also formed the DHS Commissioners Advisory Panel, co-chaired by Dr. Penny Wheeler and Bill George, and including, in addition to community members, our 4 HHS legislative chairs to continue to monitor our progress on your behalf. Our response to the OLA Behavioral Health Audit is that the audit confirmed more or less the same things we found in our own audit and process control work throughout 2020. In fact, according to a DHS staff crosswalk, we found one thing they did not, and they found 2 things that we did not. We appreciate the OLA audit mentioning the work that we did over the same period of time. This is our new oversight structure. It was some of it was roughly in place before 2020. The piece that is in place, especially now, is the senior strategy team across the middle. Our senior leaders meet quarterly, and each of our assistant commissioners brings a report to this group with risks that they can see going forward in terms of our process controls and their plans to fix them. Next slide. As I mentioned, we have also assigned process control champions. They're listed across the bottom of this slide. Each reports directly to an assistant commissioner and sits on that assistant commissioner's senior staff, and is the one at every meeting of the staff that says, are we crossing our T's and dotting our I's? They all have a dotted line reporting relationship to our Chief Compliance Officer, Shireen Gandhi, who meets with them regularly as well. Operation Stopgap, not going to go into this detail, but this was what was conducted in the Community Supports Administration, where the Behavioral Health Division sits, focused on enhanced coordination and communication, a collaborative safety environment and culture of accountability, strengthening financial management oversight, internal controls, hardwiring improvements, standardizing processes, and integrating our approach and streamlining processes on all of our grants and contracts. Operation Swiss Watch completed its discovery phase of our Lean Six Sigma analysis across the entire Department of Human Services, making 6 discoveries of potential process improvements and finding 5 centers of excellence in grants and contracts, especially in our Children and Family Services Administration. We are now entering a continuous improvement phase with a kickoff meeting that happened this morning to dive into these kinds of new controls across DHS. A background on the Behavioral Health Division, and Ms. Bombeck mentioned some of this. This was a merger of the Adult Mental Health, Children's Mental Health, and Alcohol and Drug Abuse divisions in 2018. The division then went through 3 rounds of leadership changes from 2018 to 2020 for the Behavioral Health Division, the Community Supports Administration, and the Commissioner of DHS. No consistent leadership to build a common employee culture, and need we even mention COVID in 2020. A note about the complexity of our state grants work. The Department of Administration's Office of Grants Management, which was mentioned many times in the audit, has created comprehensive grants management policies as outlined in Minnesota statute. Some of the highlights: a 6 to 9 month time frame with 32 task processes to develop and complete a request for proposal. 1 to 2 month time frame, 21 task processes to develop and execute a contract or amendment. Monitoring, including multiple site visits and a financial reconciliation, 2 weeks to 1 month time frame and 14 tasks for the reconciliation, and a 2 week to 1 month time frame and 12 tasks for a site visit. Next slide. You can see here how DHS spends its money. The 3 columns in the center, the entitlement programs for older adults and people with disabilities, are largely medical assistance and run through our healthcare processes. BHD, Behavioral Health Division, over on the right, you can see is 27% state grants. Next slide. And over many years, you can see the number of grants and contracts that have increased, and the headcount in the Behavioral Health Division to manage those contracts much lower. Next slide. This is our new organizational structure. You can see we have new leadership, new positions, new staff in different roles throughout the Community Supports Administration and also in behavioral health. Next. Assistant Commissioner Gertrude Matemba-Matassa joined us in 2020 to lead the entire Community Supports Administration. She has a background in nonprofit finance and an MBA. Jennifer Yang came over to the division in the middle of 2020 from our compliance department and has her Lean Six Sigma black belt. And we're pleased to say that Paul Fleissner joined us at the end of 2020, where he came from his role as Deputy County Administrator at Olmsted County, where he led a team of 500, a budget of 100 million with a particular expertise in behavioral health. One of the first things the team worked on in 2020 was reducing our number of 16A forms, which is a form we need to sign if work has begun on a contract before the contract is signed. We had 110 of these in the Behavioral Health Division in 2019 and 25 in 2020, a 76% decrease. One of the next things they worked on was the conflict of interest policy. They have established new training in what conflicts of interest are, employees' duty to avoid them, and to establish new control processes. And new conflict of interest disclosure forms are in the files and kept beyond the original contract date, which was all launched in October of 2020. They're working on a new contract process. They're 80% complete with it, completing several steps in 2020 and early 2021. They're now testing the contracts integration application that started in April. And the plan then is to roll it out and begin to use it across the Behavioral Health Division in July, with a plan to roll it out across the Community Supports Administration in the fall. They're also working on a new life cycle contract management report with our process, which is now 100% complete, looking at new steps from pre-award phase through evaluation and oversight at the end of the contract. I mentioned that Operation Swiss Watch brought in an outside consultant who looked at our systems compared to other states. They gave Minnesota a rating of high involvement by the legislature and DHS policy. Everything we do is in statute versus simple rulemaking. We've given a rating of low to medium, I believe, low to medium for the state's 30-year-old IT systems. Expectations of July 1 or January 1 implementation of all new programs after a legislative session. As opposed to one state where they discovered that new contracts rolled out when the IT group was ready to support it. Without that, we have a lot of workarounds in our process. The report mentioned that other states say you'll always have errors, and it's important not to blame employees for coming forward with errors and process improvement suggestions. And the report also said that DHS had made significant progress in 2020. And then COVID gave us an unprecedented opportunity to run every COVID waiver through a policy review committee of commissioners' direct reports, modeling firsthand for our entire senior staff our process of crossing all the T's and dotting all the I's. This process was recognized in the National Consultant Report as a factor in our significant progress in 2020 and resulted in no findings for DHS in the use of COVID relief funds in the 2020 single federal audit. The DHS budget from 2006 to 2020, as you can see, has grown from $10 billion to $20 billion. It's about time we stepped back and took a look at our entire contract and granting process across DHS. And for the record, $17 billion flowing through federal government, state government, 87 counties, and hundreds of providers still using 30-year-old computer systems. We had no new payment errors discovered in 2020, so our 7-year payment accuracy rate is now 99.91%, and we are going after the 0.09. Thank you very much.
Thank you, Commissioner. And just to let the record reflect, when we did a roll call, Representative Hansen he texted in that he is present. So just let the record reflect that. And so with that, we'll open to questions. And I see Representative Erickson has her hand up first. Anybody else who has questions, please raise your digital hand on the participant window. So Representative Erickson.
Thank you, Mr. Chair, and thank you, Ms. Bombeck, for that very thorough and comprehensive audit. It is embarrassing, actually, to learn that we have had to have an audit after the merger of those operations into that one division, because the department should have been much more ready, I think, for that kind of merger. And when you're sending out 700 grants, that's almost unheard of, I think, even in the business world, to have that many grants and then lack that kind of accountability. So thank you very, very much for your audit and to your staff who assisted you. And I'm glad to hear, Commissioner, that there is a process in place. Perhaps if this new process works well, we should take a look at how it can apply across state agencies, because Minnesota gives out a lot of grants. In the legislature, we appropriate millions, hundreds of millions of dollars for grants. And that has always been a bone of contention for me, because grants can get lost in the process if there's not a thorough vetting and a reporting back. And so one of my questions would be for Ms. Bombeck, is the listing of grants available to the public?
Ms. Bombeck.
Mr. Chair, Representative Erickson, so that is public information. I do want to mention that part of the challenge that we had with this audit, where it took us a bit of time to really define our universe for testing. And in that's where I say we did a couple of rounds of samples, because there were just several different lists of what grants had been let. They didn't all reconcile with each other. So we were using different sources to really clearly define our universe and then come back and take a second cut at some of those documents. So having said that, the list of grants and the vendors that is public information. But in terms of actually knowing that list, the commissioner can speak to that, whether they've really tightened up the documentation related to that. And then one other thing regarding the grants is that it's different than the professional technical contract. It is more difficult in the grants to identify, at first eye, what is a single and sole source grant, what is a competitive grant, bid grant, what is legislatively named. So you really have to get into the grants to tease that out and figure out what you're looking at.
And Mr. Chair, Ms. Bombeck, thank you, Mr. Chair. What is the range of the award to the grantees?
So we had smaller grants. I can't answer it Off the top of my head, there were some very, very large grants. There were many small grants. So there really was quite a range. Some of these grants go over several years. Therefore, I think there might have been one for $600,000. I might have misspoken, but I believe there was, we had that high of a dollar value on just a couple grants. Most of them are, smaller, I would say like in the $80,000 range and lower.
Thank you, Ms. Bombeck, and thank you again for your work. Mr. Chair, I will listen for other questions and answers, but I think it tells us that we have had an excellent audit completed, and there's a lot of work to be completed, even though DHS has begun that new process.
Thank you.
Thank you.
Thank you, Representative Erickson. And with that, along that line of questioning, Ms. Harpstead, could you give us, I think there's a couple of questions. If you've thrown around a variety of percentages, we've talked about a selection or a portion of the audit covered the behavioral. What's the total number of grants issued in dollars, total in dollars in DHS, not just in behavioral health services?
I'm sorry, I don't have that number off the top of my head, but we can certainly get that to you. The vast majority of our budget flows through our Medicaid and Minnesota Care budgets, and not through these grants. But in percentages, as you saw from the one chart, about 30% of our behavioral health and 30% of our children and family services are state grants. I'd have to get you the total numbers.
Thank you, Commissioner. And with that, next in line is Senator Kiffmeyer. Representative Erickson, if you could lower your hand. I don't have the ability to do that. Thank you.
Thank you, Mr. Chair. Appreciate the opportunity. And thank you, Ms. Bombach, for a good audit. Well done. I thought it was kind of interesting when the commissioner mentioned those two going on somewhat side by side, and then the fact that they came to most of the same conclusions, and that's always a good indication both for you, Commissioner, and for you, Ms. Bombach, in doing that. I would say too, Commissioner, you came in on the after, not only you came into COVID, and then prior to that, there are a lot of commissioner changes. That's extremely difficult, and we never want to blame the employees when we're in a situation where they needed leadership, and those things do affect them, and leadership matters. And I think you're doing really hard work, and making some of those things and seeing some of those process things are great. I have two things. Do you have a dollar? One of the things I find with when you're dealing with HHS, the percent may be small, but the dollar amount is quite large because there's such large funding streams. When you talk about going after that 0.09%, what is the dollar value? Do you have any sense of what that might be?
Commissioner Harpstead?
It would be roughly our $17 billion budget times 7.
$17 times 7?
Yes.
Okay. So I think the realization that this is a very, very large amount. And so sometimes that percentage can seem that you're really going after something really small, but it's just a small percent, not a small dollar number. The other thing, Commissioners, you mentioned IT, the high grade on one area and then low on IT. My experience with IT is it's very risky. It sounds real simple, but almost always you either build it in-house or you contract to modify. Rarely is something there. Interfacing them with all of our legacy systems and all the data, it takes a lot. And we have experience in the past of some things done poorly, high price to pay, a lot of involvement, and other times it works well. So I'm certainly open, and I know Senator Curran chairs a committee in the Senate on technology. We're looking at some other issues there, but could you just comment a little bit more about what you think on the IT updating, or if you think you ought to just, you're doing pretty well where you're at, because the cost, the labor, and the effort it takes to do new IT is tremendous.
Thank you,
That's right.
Senator Kipmeyer. Commissioner Harpstead,
I'm
if
sorry.
you could, when in that response, if I could add, could you respond to, you said 30 old systems. You have, first off, start with how many systems you have and which ones are you referring to that are outdated and you believe, at least in the reference, that they're ineffective by age?
Yes, Chair Karan and Senator. We have 2 or 3 really major systems that we use in the Department of Human Services. They're old. I can't say for sure because I'm not a computer expert whether or not they're truly outdated. I can tell you that our minute staff has a significant goal for the next several years to make our current systems continue to operate effectively. And they are actually looking to hire COBOL programmers to be sure that we can continue to operate our current computer systems. I can't even imagine the cost of replacing those systems. Haven't checked that out. But so the task right now is to do what we can to make our current systems last just as long as they possibly can. I will tell you that the Behavioral Health Division and Jennifer Yang, our process control champion there, has found a new application called Agile Apps. And I'm not sure what that is, but I love its name. And she's using that to create this contract and grants management system. And we're pretty happy with it so far. It's under pilot right now. If it works well, we are going to expand it to the Consumer Supports Division, Community Supports Division. And Jennifer actually came from our compliance office where she was looking at this system for the entire Department of Human Services. So if it works well there, we're likely to expand it so that everyone in the department is using the same contract and grant management software, even if it's on the old computer system.
Thank
Mr.
you,
Chair.
Commissioner. Senator Kipmeyer, follow up?
Yeah, I just follow up. So that's exactly how I look at it as well, is that sometimes these COBOL language, they're often very dependable, very solid, always have to be maintained. They certainly do that sitting on a system, IT system equipment that needs to also support it. But the interface, such as Agile, when you have that interface, that's for us. That's how we work with that data that might be in COBOL language. So I'm glad to hear that because I think that the effort it takes to do that is tremendous. So I'm glad to hear that. And Commissioner Tomes and I had talked about Agile as well. So one of the things Commissioner Harpstead is on your process, you know, the top leadership and all those things. When you're managing so much and it's so huge, you've got to have a methodology. And so I commend you on that. And it seems to also be producing good results. So sometimes we have a lot of structure. We spend a lot of time. We don't really get a lot of value out of it. This seems by your numbers and so on, that you're also getting value out of that structure. Would you concur with that it's generating that?
Commissioner Harpstead?
Chair Karan and Senator, yes, I think it is. And again, I think I said this in the newspaper that we're in the 2nd or 3rd inning of a 9-inning ball game here as we look at improving these processes and controls across the department, which will take some time. But I'm very pleased with the results in 2020. No new payment errors and no errors in the management of millions of dollars of federal COVID relief funds, are 2 examples of some progress that we are making.
Thank you, Commissioner.
Thank you, Commissioner.
Mr. Chair.
Senator,
I just want to say
Senator
that, I really appreciate the fact that you're in the 2nd and 3rd inning of a 9-inning. That was my sense as well. But you're a huge agency. If you are able to get a handle around this in DHS and to do some of these things, it's also an example for other agencies, but only HHS has this kind of huge dollar amount, huge structure touching so many people. So it's really critical. And thank you for your work, Commissioner. Thank you, Mr. Chair.
Thank you, Senator Kipmeyer. Senator Frentz.
Thank you, Mr. Chair, and thank you, Commissioner. First, thanks, Ms. Bombeck. Great job as always. This information is so helpful to us. It's the taxpayers' money. Appreciate your work. I usually like to do the sports metaphors for the OLA, but never mind that right now. Commissioner, I guess my question is to help us get a sense of what you think of the report and how we're going forward. I'm interested in where we've been. We learned from that. That's why these audits are so valuable. But the real question for Minnesota is where we're going. I was struck by the conflict of interest information. It sounded like for that sampling, 21, no information at all on conflict of interest checked, 4 with inadequate information. My question is, as you look at that finding, what can you tell us? Conflict of interest is an area where it takes time. It's not glamorous, but it avoids some problems that can grow into really big problems. And I'd be interested in your thoughts on that.
Commissioner Harpstead?
Chair Cran and Senator, absolutely, yes, sir. We need to be sure that we're taking good care of that conflict of interest question. I will tell you this much. It's not clear to me that we did not actually check conflict of interest on the grants and contracts in the audit. One of the things we learned was some of our managers thought it was okay when the grant was over to get rid of those documents. And so the OLA can only audit documents that still exist in files. And one of the things we heard was people thought that when that contract was done, they could discard the documents. That's not the case, and we need to change that, and we have already changed that policy. But it doesn't necessarily mean, for the sake of the trustworthiness of the group's work for the taxpayers of Minnesota, that those processes didn't occur, as much as we know that they didn't keep the documents beyond the time of the contract.
Thank you.
Senator Frantz?
Thank you, Mr. Chair. Thanks, Commissioner. It's just a simple, small little agency running through a few taxpayer dollars every year. We do appreciate the hard work. And I hope this is part of a process where in the future, Minnesotans will look at DHS and say, hey, they did some things that really helped. And with that, I would just turn the microphone back to our designated hitter, Senator Mark Curran. Thanks, Mr. Chair. Thanks.
Thank you, Senator Frantz. And Commissioner Harpstead, to follow up a little bit on Senator Frantz's question, and you talked about, well, you indicated that in the audit, it didn't cover that component, and it may or may not have been completed as far as the conflict of interest. But being a longtime government employee, it's been institutional in data retention, and nowhere else have I ever seen anything where a record was discarded, regardless of what the program was and or practiced or promoted. And so I do have concerns that that was a standard practice. And if that was a standard practice for conflict of interest, was it a standard practice for all other critical documentation that was required? Because what we're not talking about is a new program. And I understand you've inherited a longstanding program. And so I do have concerns that we do need continued updates, because my initial question when Ms. Bombach provided the update was the information available or was it just not provided? And I'm not convinced we know either one of those answers. But to assume that, well, somebody just thought they could get rid of it, I don't quite buy that, because that is not a practice that we have and promoted. It doesn't matter what it is. We've always been on the cautious side of retention, especially in lieu of good procedures that define exact retention for the various processes. So I would like further follow-up to make sure that those things are in place. And then did that same type of records management practice and behavior extend well beyond the current program that was audited? So thank you. Commissioner Hart said, if you could, we'll be working together on these things in the future, but we really need to understand some of the work you did. What else did you find? Because you concluded that, and we'll do this at a separate opportunity, but you concluded that your assessment agreed with the assessment just for behavioral health services. But what else did you find in the other programs that mirrored these same types of outcomes? So appreciate it.
Chair Kren, yes, thank you. So one thing I mentioned is that in Operation Swiss Watch, we've looked around at these same processes across the Department of Human Services, and we have found 2 centers of excellence in our Children and Family Services Administration, where we've got a few people that are just natural I-dotter and T-crossers and have buttoned up everything and made sure all the documents are in the files and have very nice, clean processes that we can learn from across DHS. And so we have not found the kinds of issues we found in the Behavioral Health Division across the entire department. And again, many of our, the vast majority of our budget flows through our Medicaid and Minnesota Care processes, which are very different, generally federally mandated in many ways in terms of processes and systems, and not like the state grant process, where every grant is different. And as you've heard, we have hundreds of grants. They all start up on July 1st and January 1st, and it's quite a challenge to manage each and every one of these different grants and do every one of them cleanly. But that's no excuse for not making sure we've done conflict of interest forms and that they remain in the files. And so you can see that our group tackled that as one of their very first items and made sure after training in the fall that that documentation process was changed forever.
Thank you, Commissioner Harpstead. Representative Liebling.
Thank you, Mr. Chair. And so, of course, the conversation has changed since I raised my hand, but I just did want to make a few comments here, not so much questions. But first of all, I think it's important to retain the context here. Of course, thank you, Ms. Baumbach, for doing your great work as always. And, you know, this is extremely helpful. It's so important for us to make sure that the dollars that we allocate go where they're supposed to go and that everything is as it should be. But we, in this particular area, we also want to keep our eyes on the fact that there are a lot of lives touched by the department. And of course, one of the huge reasons that we want to make sure that the dollars go where they should go is that we will never have enough money to do all the things that we could be doing, that we maybe should be doing for the citizens of Minnesota to help improve their lives. And there's a ton of need out there. And I just do want to acknowledge and give us the context that it's not only about the many millions of taxpayer dollars, it's also many, many, many lives of Minnesotans. So, you know, we know that we have over a million people, Minnesotans, on our public programs in the state. And these grants are touching the lives of many, many more who are not necessarily on our public programs. So, you know, that really needs to be kept in context. Another thing I just wanted to mention, I'm glad to hear sort of the discussion about our systems, our IT systems. I think anybody who's paying attention to this area knows that we as a state really need to start up some kind of a process for looking at and possibly replacing some of these systems, all of them, maybe, I don't know. This is a huge challenge. I'm not an IT person. I know some of you are, and I'm really grateful to have those different pockets of expertise in our legislature because we're going to need them. Because this is, you know, I constantly am hearing about how difficult it is when we want to make any kind of a change. We have real challenges changing our systems to keep up with what we're doing. And we learned this from in the past, we had challenges with different kinds of technology. One of the things we have to do is simplify our rules before we start building new IT to match those rules. So I'm glad there's a lot of interest in this. As we would begin to invest in new technology, we've got to make sure all of our ducks are in a row, that's for sure, because it's very easy to make mistakes and it's a lot of money, and yet it's a super important issue. And finally, I just really wanted to say, and this is why I raised my hand in the first place, I really wanted to acknowledge Commissioner Harpstead. Those of us who are in HHS, it's not the first time we've heard about her, what the work she's been doing. She does stay in touch with us as chairs. She's very good at that. And I kind of like to joke, sometimes to a fault, right? She's calling all the time to tell us, you know, what her next step is to get. And I have to say one thing that is, I think really makes Commissioner Harpstead stand out from the point of view of legislators. She doesn't just call us to tell us what she's already going to do. She calls us to get our actual input before she makes a decision on many, many things, which I can't tell you how much I appreciate that as a legislator. But also, I just really want to acknowledge that I believe she has the hardest job in state government. And she's done it extraordinarily well because, as you've all seen, she inherited some pretty difficult stuff. She's, to my knowledge, the first commissioner of human services who comes in with a deep management background, which is very different. And, you know, I think the state is extremely fortunate to have somebody with her depth on the management side to be able to really start to figure out how to get our systems working better and get a better management structure and all the things she's talked about. So, you know, as we're talking about this look back, and it really is a look back because the period audited ended March 2020. And it's great that, you know, the department did their own audit at the same time. The OLA did an audit. These things are extremely valuable. The information is extremely valuable, but we're not back in that era anymore, for which I think we're all grateful. We're moving forward. We have better systems in place. And I'm just really looking forward to seeing her continued work and what the department is able to do, hopefully with the partnership of all of us, because this is so critical to the lives of so many Minnesotans, and not just those who are paying their taxes, certainly to them, I should say to us, because we're all paying our taxes, but also especially to the people whose lives are being touched by the work of the department. So thank you, Mr. Chair.
Thank you, Representative Labeling. And you referenced the technology component, and it's vast and broad in the touch of DHS, especially when the systems they depend on, as well as all those in the counties who do the implementation, depend on. You hit the nail on the head, simplification of process, but as Commissioner Harpstead has heard me many times rail on, we still have to have the implementation and the training and the knowledge at the business rule level throughout the entire life cycle of what we do. Only when we marry those two can we feel great about the new systems, or as we update the systems that are in place, can we expect the better outcomes. But we agree with you, and we're going to continue to work on that. So with that, Senator Benson.
Thank you, Mr. Chair, and Commissioner Harpstead. Thank you. Ms. Bomback, thank you again. You gave me a preview of this, and I've talked with Commissioner Harpstead. I think the work that the OLA does is really important to build confidence. For example, and this isn't a confidence building report, but that it has come out to be, problems clearly identified, root cause analysis. I know the OLA isn't consultants to DHS, but they certainly help the legislature get out of sort of the high level policy and get to there are root causes that are issues here, and we need to keep an eye on those. And Commissioner Harpstead, I believe, has taken those seriously since she got on the job. One of my concerns, and I've conveyed this to Commissioner Harpstead over more than a year. I've lost track of how long you've been there. COVID sort of slinkied all of our timelines. But how are we going to change the culture that allowed this to happen in the first place? I'm impressed with the leaders that you have put in place that are putting in a structure around some good-hearted people. The people in behavioral health want to get this grant money out the door to people who are trying to do good things. And so there's a really soft side of the Department of Human Services, but there also has to be an accountability framework. We had some problems with whistleblowers, maybe not technically whistleblowers, but how are you creating a culture that those people who want to just get the money out and help someone know that they also need to be accountable? But if there's not accountability, do they have a way to get around or outside their manager so that they can say, these problems still exist, or I feel like the person who's doing their job isn't doing it up to our standards? So talk to me about how you've made those changes and not just the org chart changes.
Commissioner Harpstead?
Yes, Chair Curran and Senator Benson. One piece of training that was beginning when I came to DHS was training across the Department of Human Services in collaborative safety. And I've done some presentations of this to our advisory panel as well. Collaborative safety is a way of tackling problems without tackling the people. And it's a way of figuring out what root cause was and getting at that without looking to blame and shame people that were involved in it. Because if we don't give people the right tools to do their job, we can hardly blame them when problems arise. And so we're doing that training across the department. We're now developing communities of practice in collaborative safety. Many of the Minnesota counties are using this model as well. It's a way to create a culture that gives people the confidence that they can come forward and report problems and tell us what's going on without feeling that there's going to somehow be retaliation against them for doing that. I will also say that this process that we have in place now, where our assistant commissioners come forward every quarter and talk to us about potential risks and the things they're doing to deal with them, is a natural conduit for employees to come forward and suggest areas that we can improve so that their assistant commissioners can come forward quarterly and talk about the things we're working on. Clearly, in the last couple of years, we have been asking for where the issues are so that we could address them. And so I'm hoping that employees overall feel like that's what we're looking for, as opposed to suggesting that they keep quiet and don't come forward with issues. So that's a piece of it. Also, I will tell you that Gertrude Matemba-Matassa and Paul Fleissner are long-term managers of large organizations and understand how to build culture and have been doing a good job of creating a good culture inside of the Behavioral Health Division. And finally, really knitting together those original 3 organizations that came together as one to create a new Behavioral Health Division culture. And so I'm confident that their work is creating a good, strong culture inside that division now. And we still have processes and systems in place where people can come forward if they need to. We did switch this year, in the middle of the year, from an anonymous hotline to a confidential hotline, because we found that the anonymous hotline was giving us little snippets of information, not enough to get to the bottom of problems. So we switched to a confidential hotline where people could confidentially report things that they see, which enables us to ask questions, get more information, and get to the root of problems. And that's been well received across the division, across all of DHS. And so I think those kinds of steps have also been helpful. So we continue to look all the time at what we need to do with our culture to enable employees to come forward to report issues.
Okay, thank you. And then
Senator Benson,
follow-up question. So not to follow up, but an additional, had to be 2017 or 2018. Maybe it was the spring of 2017. I was shown a giant multi-page flowchart of IT system projects and their planned rollout. And the legislature wasn't asked for any money for it, and it appeared to be being done internally. And so the 30-year IT system, I don't know if that actually led to problems in behavioral health. It might have made it harder, but I don't think it was a root cause. Frankly, checklists can be done on a Google Doc. Not to be flippant, but you can do things manually if you need to. But there is somewhere a massive chart of all the IT systems and a plan for updating them. But I don't know if Senator Curran has seen it. He has this special division in the Senate that deals with IT. And he and I have talked several times about criteria. Has this been used in other states? Is it commercially available off the shelf? The legislature is really good at sticking our nose in and saying, well, if you have an asset that's over this number of dollars, you're not eligible for this program, but we never look at it in terms of all the other programs. So I've been asking for years for DHS to come with streamlining so that we can align all our asset tests, things like that. But also, if you want money for IT, show us that it's been tested somewhere else. Show us that it's commercially supported so that we don't have to do a bunch of back-end work. I understand you need to hire COBOL programmers to keep your legacy databases alive. Yes, but if we're going to go forward, then let's look at work that's already been done. Let's put in criteria that meets a modern standard. And let's have the legislature, instead of just throwing ideas into an IT system and constantly needing reprogramming, to respect that there need to be sensible business rules. If, you have Chair Liebling and Senator Curran and myself on a conference committee right now, and we have no proposals for IT system updates at the department in either body. And I don't recall one from the governor's budget. And so we're here, you've heard today, we're ready to listen. And so if there's an opportunity for us to solve the 30-year legacy problem or take a bite out of it, then let's not overlook this opportunity.
Thank you, Senator Benson. And with that, we've got just over 10 minutes left. We have Representative Quam.
Thank you, Mr. Chair. And I've done some coding and did variations of COBOL, so I understand the dust they have to blow off on doing some of that. But there's a lot of knowledge out there on how to update those things. My concerns are, and I had typed some messages into the chat portion. You had a fraction of a percent that there were issues of that you discovered, but frankly, these grants vary a great deal from maybe a few $100,000 to to millions and millions of dollars. And so it'd be nice if you were able to, for the appropriate legislative committees, have the additional information of it was point such and such a percent, but this dollar figure. The other thing is it's very disconcerting when documentation is thrown away. Frankly, those of us that have been around a while have seen where federal dollars, because part of the funding and almost all these programs, part of the funding has federal dollar component, and we failed and had to pay the feds back for a portion of it. So it'd be interesting to understand how many of these had some federal components, and comparing, we audit, are you following these procedures, et cetera, et cetera. If and when there are any component of federal dollars, we also need to have the comments in these audits about compliance or concern about compliance with the federal policies, procedures, et cetera, because of the ramifications that we have seen over the years. And so that should always be part of the discussion. So the rest of the story, plagiarizing Paul Harvey, is often very useful. And as we discussed earlier, many of the members of this committee are working on conference committees, working on the budgets and that. And so when an audit comes up and we discover something, we can maybe have extra due diligence in the language to clarify and avoid issues. And that's part of the reason why we're here. So I look forward to the offline communication of additional information. And thank you, Mr. Chair.
Thank you, Representative Quam. Any comments, Commissioner Harpstead, on that?
Yes, thank you, Chair Kren and Representative. A year ago or more, I've also lost track of time. Maybe my 90-day report, let's go back to that, after I started in 2019, pointed out all the errors we could find that year. Many of them made the newspaper, were very, very visible. Others were not. And they added up to about $100 million over a 6-year period. And that's where we got that original calculation in that 90-day report of 0.1% errors in over 6 years of all of our spending. In 2020, again, we've discovered no new payment errors, which brings us to 7 years and a 0.09% error rate. I don't say that ever to diminish the importance of the $100 million. That's a lot of money. And we need to be trustworthy to the people of Minnesota for every dime we get, which is why we're going after the 0.09%. The only reason I say it is because I think this committee needs to know that DHS is not a 50% error rate or a 20% error rate, because that would really be horrendous, and we'd have to be in a whole different environment. And we don't even have a 5% error rate, which would be something that we would have to take different kinds of actions about. So small percent of the budget, but certainly every dime counts.
Thank you, Commissioner Harpstead. And along those lines, we can be technically correct and financially appropriate and audit to 100% accuracy from the controls perspective and documentation and statutory. But I think in each one of these, we know it's really these programs, you touch people, right? Every time we talk about, an IT project, right? It's dollars, and those are extremely important, but you touch people in the most critical and vulnerable in society. And so for us, and to me, the greatest challenge that we want to see is one, not that we haven't solved those compliance issues and what have been identified here, but truly the effectiveness of the actual programs and the grants that are issued. Every time we have an outcome we deem unacceptable or we'd like to improve, we keep looking at the same populations where we already have hundreds of millions of dollars spent on those populations, either through direct appropriations and function of either Medicaid service program, Medicaid program. But these grants, in addition to supplement in the very areas of critical need. And every day, I don't know that any of us can say, wow, that we're getting, the programs are meeting the need. So I think for me, not only to comply with what's been identified, and I think you've identified them, but the true overall effectiveness of the program and its intent. That to me is one where we need to make sure, or we would like you to help us make sure that we know we're getting great value in each of those dollars as they move out there, because that is one of the most critical areas. So with that,
Chair,
we're just coming up to the end. Yep, I see Representative Quam. Go ahead.
Yes,
Quam.
For the people that are listening and watching, the reason why we care so much about not wasting any money or having issues is there are so many programs that could use that money. So every dollar saved is something we can spend on somebody that needs it. And that's where, yeah, we're persnickety, but the reason is we're trying to help more people. Thank you, Mr. Chair.
Thanks, Representative Quam. And I think we all agree with that. And we want to make sure that it goes to the highest value and we're actually accomplishing the goals. And when it touches people, it really matters. It's still hard, again, it's hard-earned dollars when it's just a financial component, but this is both. And one, I think it's actually the reason for government is to take care of the things that DHS is charged with. So with that, any further questions? I don't see any hands raised. Any last call for questions? Well, we appreciate everybody. We know it's busy. We all would appreciate the ending of a session, whatever that looks like, whenever it happens, if we recognize it from February of 2020. But everybody's doing great work. We appreciate your participation, Commissioner Harpstead, and certainly the OLA office and Ms. Bombach and all the work that you do. This group is, and that's why I believe it was necessary to have the conversation. We've got a couple other issues coming up, and we'll continue as we look towards the summer and the work rolls out to the OLA. I think probably maybe end of June, maybe sometime in July, we could resume into when the Capitol opens, we could resume in person and get back to business as usual. So appreciate everybody's participation. And with that, I see no further hands. We'll adjourn the Legislative Audit Commission. Thank you, everybody, and have a great day.